All right. Hi, everyone. Thanks for joining us today. Today, we're going to be talking about a return to school health, opportunities for prioritizing student health in the upcoming school year. My name is Jacob Szeszulski, and I'm an assistant professor at the Institute for Advancing Health Through Agriculture at Texas A&M AgriLife Research. Today's webinar is being hosted by the Michael and Susan Dell Center for Healthy Living at the UT Health School of Public Health in Austin. Before we get started, I just want to make some housekeeping announcements. The webinar is being recorded and will be archived along with the presentation slides on the Michael and Susan Dell Center website at msdcenter.org. If you have any questions during the presentation, please enter them into the questions chat box. We'll have time for Q&A at the end of the presentation. I'm excited to announce today's speakers. First, we have Laura Rolke. She's a postdoctoral research associate at Texas A&M AgriLife Research. She'll be followed by Swati Iyer, a medical student at Texas A&M, followed by Michelle Smith, the Texas statewide coordinator for Action for Healthy Kids. And I'm Jacob Szeszulski. I'm an assistant professor at Texas A&M AgriLife Research. I'll be the moderator for today. Before we get started, before we jump into those presentations, I want to quickly go over our agenda for today. Really, our big purpose of this presentation is to talk about two things: local wellness policies and their implementation, and school health advisory councils. We think these are really two important tools for setting priorities related to student health in the upcoming year. And so we really want to hone in and emphasize on those two things. We also really want to share a lot of resources with you. So we're going to be linking you to different resources throughout, and we're also going to be sharing a network with you that you can join to help with those things. One of the things you might be asking at this point is why policy? Why the big focus on that? And I have this quote here from Gandhi: a policy is a temporary creed liable to be changed, but while it holds good, it's got to be pursued with apostolic zeal. Really saying that policy is super important at setting priorities, and that we need to make sure that we're doing everything that we can to carry out those policy goals. And so today we really want to help you with your policies for the coming year and help you to set the tone for school health going into the next school year. Some quick facts on local wellness policies. As low as 20% of local wellness policies meet federal guidelines. Only 25% of districts are fully implementing practices in their local wellness policy. And locally developed and well-implemented local wellness policies are related to better school health environments when compared to template-based local wellness policies. In Texas, 95% of all school districts are currently using a template-based policy. And so there's room for improvement in that. And today we want to talk about some of those areas where we can help improve policies and begin setting priorities for your next school year. So with that, I'm going to hand it over to Laura. She's going to talk to you about some work that she's done in this space, and then we're going to share some resources with you as well. Go ahead, Laura.
Okay. So today I'm going to be talking about understanding school-based local wellness policy implementation, the relationship between the school district implementation stakeholders and wellness goals. So, I can't move the slide, Jake. Okay, so as Jake just introduced, a local wellness policy. So this is a written document that guides a local educational agency or a school district's efforts to create a supportive school nutrition and physical activity environment. So this is a document, this is that school districts can use to kind of guide what they do in practice. This is what we're looking for with policy. As far as the background of local wellness policies, it goes back really to 2004. So we see with the National School Lunch Program required all participating school districts to adopt a local wellness policy. So they had policy that was going towards nutrition, physical activity, and other school-based health goals. We see that in 2005, the Texas Association of School Boards released a template to help guide this process. And then over the next decade, we really see some changes to what needs to be in a local wellness policy. So like adding more nutrition promotion goals, changing some of the content and requiring it to be publicly available, as well as adding requirements for it to be assessed every 3 years and have those records available so that people can see it. And of course, as we make these changes, the Texas template was updated in 2016, and then starting in 2021, the USDA final rule states that local wellness policies should be started to be assessed. So what we're looking at is that we not only have a policy in these districts for school wellness, but that every 3 years someone is ideally assessing and reviewing. So for what this means for Texas is that schools can use a template. The template exists, as Jake just showed, about 95% are using a template, and that they must update it every 3 years. They must document the evaluation process, and they must share that document widely. And so what I did for this study is look at who is named in those local wellness policies. So at the end of it, it usually says who the stakeholder is, who's in charge of evaluating the implementation, and then looking through to see how many different types of goals they had in each of the categories. So for this study, we looked at 111 school districts in one of the Texas Public Health Service regions. And then based on the Texas template, which there are 4 nutrition promotion goals, 5 nutrition education goals, 7 physical activity goals, and 3 other school-based health goals. And so we use this to kind of understand. On the next slide, it shows kind of what we did. So whether or not they had the goal mentioned on their policy. So in this case, it was the district shall provide an environment that fosters safe, enjoyable, and developmentally appropriate fitness activities for all students, including those who are participating in physical education classes or competitive sports, would equal a 1. So we're just trying to see from each of these different 111 local wellness policies, counting which ones they had in each category. And then when we, if you look at the next slide, we use descriptive statistics, and effect sizes were calculated for the number of goals within each stakeholder category. So the stakeholder who is responsible for evaluating, we grouped them all into those categories and looked to see if there were differences in the number of goals. So from here, you can see, so we had 111 districts. Of those, 87 had an academic leader selected to be that implementation stakeholder. So this is something like a superintendent, assistant superintendent, or like a curriculum director. There was also health leadership, so which is a little less, around 8 individuals. So this is like a district wellness coordinator. Nutrition leadership, which was, there were 6 individuals, so like a nutrition services director. 7 for physical activity leadership. And then 4 were non-leadership, or a SHAC chair or school health advisory committee. And what we did is just look at kind of within these categories, the averages. So if you look at the column on the far right, this is the average number with the standard deviation. So you can see kind of across all categories, kind of where that middle line is. And see that these vary between the different categories. The academic leadership is N equals 70. We just talked about it being N equals 87. I excluded the ones that had a designee. We'll get back to that in a second. But from here, you can kind of see most of these are under the average, and that physical activity leadership stands out. So if you look through the nutrition promotion goals, it's a little bit higher than what that average is for all of them. But then when you start looking at some of the other categories like nutrition education, physical activity, or other school-based health activity goals, it's much higher. So we start to see that there's variation for who that implementation stakeholder is and the number of goals that they're selecting. Jake, if you'll go to next slide. I'm just going to dig into a couple of areas here that we thought were really interesting. So that is that nutrition, or the physical activity leadership, and comparing it. So you can see here, this is the average and then the effect size. So we really start to see that difference between nutrition education, including physical activity goals, the physical activity leadership. What of those, added more of those. And then we also see it with the school-based. So definitely starting to see a difference. Jake, if you'll go to next slide. And then this is when we kind of pulled out and looked at academic leadership with and without a designee. So what that means is that academic leadership, so like a superintendent or assistant superintendent, could have someone designated to do it in their place. So when we see that they have a designee, we see a little bit more goals selected overall. Really seeing it a little bit more here with the physical activity goals, as well as the other school-based. So as far as seeing differences, that helps us understand on the next slide that there are differences in the number of goals selected and who is responsible for evaluating. And when we really start to see multiple stakeholders, so things like having a designee on there, we see changes in the number of goals, as well as when you include physical activity leadership. So it really helps us to understand, or helps us to kind of guide research and think more about, like, it's important to have different people that are helping to evaluate implementation, naming different individuals that could bring a different perspective and help, influence the policy decisions that are being made. So awesome. And I just want to say thank you to my co-authors on this work, as Dr. McMillan, Reeve, Rethor, Segan, Fowler, Szeszulski, and Walker. So thank you all so much. And Jake, do you want to hop on and explain the wellness policy resources?
Yes, thanks, Laura, for the great presentation. I just quickly wanted to point out that this is your state resource for local wellness policies. The link is down here at the bottom. On it, you can see two things. One, they have this wellness policy worksheet, which helps walk you through how to build a local wellness policy. And then down here, you can also see that they have links to the USDA webpage, which also has resources related to creating your local wellness policy, and even policy consultants if you need additional resources. So if you're thinking about updating your wellness policy in the next year to include some new goals or change some different goals, this link is a great starting point, and it can get you to this wellness policy worksheet, as well as some additional resources that can help you to develop your wellness policy. I'll also say that the piece that Laura was talking about within her presentation is here within the wellness policy worksheet. So it has some standard text here that you can put in for implementation about who will oversee the implementation of this policy. One thing that it doesn't really tell you within the worksheet, though, is that you can list multiple people in this location. So as Laura was pointing out with her presentation, yes, physical activity leadership had there was more goals when a physical activity leader was listed here or a designee here. So really thinking about who are the comprehensive list of stakeholders we want to evaluate implementation, and listing them all in this section as you go to update your local wellness policy. I also want to point out that we said earlier in the presentation that template-based policies aren't as well implemented as those that you create on your own. Now, we know it's a lot of work to go out and create your own wellness policy, but the TASB template actually goes in and has spots for other goals. So while you can choose from this list of standard goals, for example, you could choose item 1 on this list, or item 2 on this list, or item 3, or all 5 items, you can actually go in and start writing some of your own goals. And so this is important so that you can start to tailor the wellness policy to your district, right? These goals are here as an example and to help you address federal standards, but there are things that each district needs that are specific to them. And so if you want to go in and write your own goals, they allow for that. And so I would say start with the template, but make sure you're writing in things that are important to you and to your district. Last thing that I want to talk about is that the template generally focuses on nutrition and physical activity because that's what's required by the federal policy. But we know with COVID and all of the other things that have been happening in the last couple years, that it's not always about physical activity and nutrition that's important for health. And so we have this section for other school-based activities. And so if, as part of your local wellness policy, you want to start thinking about mental health or other things that could help improve the comprehensiveness and quality of your local wellness policies, you could add them to this section within the template. And so lots of good resources on this template, but ways to customize it to your own district based on what type of goals you have, as well as different health priorities that you want to be thinking about for the coming So I'm going to pass it off now to Swati, and she's going to talk a little bit about an analysis we've done on urban and rural schools, and then I'll share some more resources with you.
Thank you so much. Well, hello, everyone. Good afternoon. My name is Swati Iyer, and I'm an incoming second-year medical student at Texas A&M University. Before I start, I just wanted to thank everyone for giving me the opportunity to speak today. As a medical student, I'm really passionate about the intersection of nutrition and medicine and using nutrition as a means of preventative medicine. So today I'll just be talking a little bit about the urban-rural differences in school districts' local wellness policies and policy implementation environments. So before beginning, I just wanted to highlight the importance of this area of study. So it has been seen that unhealthy lifestyles tend to predispose many students to chronic diseases like obesity, with significantly disproportionate rates of obesity seen when comparing those who live in rural areas versus those who live in urban communities. But since obesity can also be generational and is often chronic, identifying preventative behaviors like physical activity and nutritional health can be useful targets that we can use to leverage in an attempt to address this issue. So what exactly are local wellness policies? Well, as other people have already stated today, local wellness policies are written documents that guide school districts in their efforts to establish environments that help to promote healthier living styles. So it's therefore evident that local wellness policies are a really great example of leverage points because children spend an average of 6.5 hours in school per day, consume 2 out of 3 of their meals at school, and receive up to 40% of their physical activity during school hours. So it thereby makes intuitive sense that good and well thought out, comprehensive, well implemented programs would be associated with superior school health environments, as well as better nutritional and physical activity outcomes. And in regards to the differences seen between rural and urban policies, there tends to be some unique differences that rural policies tend to face that seem to be linked to social determinants of health. These tend to include fewer staff, less financial assistance, and more challenges in simply finding healthier food choices. So in regards to assessing a local wellness policy in whole, it's important to consider both the local wellness policy itself, the quality of it, as well as the support that's used during its implementation process. So that's exactly what we wanted to study in this research model. Our goal was mainly twofold. We wanted to see if there were differences in the local wellness policies themselves, and then understand how the implementation differed based on rural versus urban areas. So to first understand the differences in the local wellness policies themselves, what we did was we ended up doing a cross-sectional analysis, which this just means we were looking at data that was collected in a single point in time. We did this by using TEA School Locator and identifying all public schools in one public health region. Then we collected each school's local wellness policy document and compared them to the state's template. And the state's template was essentially broken up into 4 categories: nutrition promotion, nutrition education, physical activity, and other school-based activities. And so our goal during this process was to just see how many of the goals in the state template were actually found within the school's local wellness policies. Then to understand the support that was being used for the implementation process between rural and urban districts, we conducted a district website audit, which we used to gauge how districts were implementing local wellness policies and the infrastructure that they used for this implementation. So the key metrics that we wanted to track in this process were the wellness plan, the completion of the triennial assessment, and the presence of a school health advisory committee, also known as a SHAC. So these are our preliminary health results that we have seen so far. So in regards to the needs assessment with the nutrition promotion goal, so you can see in red here that there is a significant difference between rural and urban health models, but when corrected for covariates, the statistical significance seems to disappear. In regards to the nutrition education goal, we do continue to see that there is a significance statistical difference between rural and urban models, with rural models having less nutrition education goals, and this statistical significance is maintained when corrected for covariates. In a similar fashion, when we're analyzing the physical activity goals, we do see the same thing with rural, that there is a difference between rural and urban local wellness policies, with rural once again having less physical activity goals. But when we do correct for it, we see that this difference tends to go away, and it's more centered around the revenue per student. In regards to school-based activity goals, once again, this difference is sustained, with rural schools once again having less policies or less goals than urban areas. And also, we just wanted to compare how many total goals both of these programs had. And it was once again seen in both when corrected and not corrected for covariates that rural schools tended to have less goals than their urban counterparts. So now, in understanding the differences for support and implementation, when we looked at the wellness plan, we saw that there was once again a difference with rural schools having less wellness plans, but when corrected for covariates, we saw that this tended to be more existent as a result of the revenue per student and not so much due to the implementation of the local wellness policy itself. And there was no statistical significance seen in regards to the triennial assessment. But in regards to the SHAC, we could see actually quite a bit of interesting information here. So when comparing rural and urban models again, we could see that the rural models tended to have less implementation of SHACs, and this was sustained when we corrected for covariates, and we could also see that there were driving forces based on revenue per student and students per school. So I know this is a lot of information being presented, but these preliminary results do tell us a significant amount of information. It goes to show that because rural schools often had fewer local wellness policy goals for their nutrition education and other school-based activities, and tended to have fewer total goals overall, if we could use this as a leverage point by creating better local wellness policies that are more tailored to schools, we have the option to essentially make our nutritional health and education better in schools. In regards to implementation and support for implementation, by working to prioritize creating stronger SHACs, because rural schools are less likely to have them, if we do leverage this point and be more intentional about creating sustained SHACs, we could help to prioritize this student health as well through a different avenue. And with that, that is the end of my presentation. Thank you for your time.
Thanks, Swati. Great presentation. I think the difference between urban and rural schools in both the number of wellness goals that they have, as well as their supports for implementing those goals, is really interesting. One thing that I did want to point out back to this TASB resource page, there is a resource on there for a wellness plan template. And so what the wellness plan is it's a document that kind of supports the wellness policy. The wellness policy is the formal goals that the district has set up. And the wellness plan really tells you everything about how we're going to carry out those goals and who's responsible for what. So as you can see here, this is kind of the heading of the wellness plan template on the TASB site. I do want to point out two things that are highlighted in red here. The wellness plan is intended to implement the policy, which has been adopted by the board, right? So you develop your local wellness policy, it's adopted by the board. Now what? The next thing that most school districts should be doing is looking at the wellness plan and writing up a wellness plan on how to go about implementing those goals. The second thing I want to point out down here is that the district's local school health advisory council, or SHAC, will work on behalf of the district to review and consider evidence-based strategies and techniques. And so really the wellness plan is something that's developed in coordination with the SHAC or by the SHAC to identify the best ways to go about implementing those local wellness policies. So once we set our priorities, we really need to figure out how to get those done, and the wellness plan is template is one way that can help you do that. The wellness plan goes through and it gives really detailed spaces for this information. So for example, related to goals for nutrition promotion, you can write each goal in, and then you can write the objectives that will help you lead to those goals, right? So what are the steps to get this goal complete? And then what are the resources needed? What are our measures of success? Who are the school and community stakeholders that need to be involved in this process? And so once you begin to fill all this information out, you really have clear and concrete steps how you're going to reach those goals in your wellness policy. And so while the wellness policy is the foundation, the wellness plan is really important to making sure that these are carried out. And so one thing I did want to point out is that in our needs assessment, we only found that 32% of schools had posted their wellness plan either on their district website or on the TASB site. So only about one in 3 schools is actually developing a wellness plan. And so I think there's a lot of room for growth in this area in the coming year, and thinking about how do we carry out this wellness policy that we developed by developing a wellness plan and putting those goals into action. So another resource I wanted to share with you. And then because SHACs are such a big part in school wellness, we're going to have Michelle Smith talk next a little bit about SHACs and about resources for SHACs and how to go about developing a good SHAC at your school. And so she is going to come up next and talk, but I think we're going to do some quick polls here first. So if we want to do our first 3 poll questions, we can do those now. All right, first poll question. Have you ever served on a school health advisory council? And if so, how long did you serve? Go ahead and click your answer there. Oh, so it looks like we have about half the group here that has never been on a SHAC, 17% that don't even know what a SHAC is, and then we have, looks like about 30% who have been on a SHAC 1, 2, or 3+ years. So lots of room there for teaching about SHACs, Michelle, and I think we have some people we can get involved in their local SHACs next year. Let's move on to the next one. In the 2022-2023 school year, my SHAC will meet online, in person, a hybrid of online and in person, or I don't know. All right, let's see what we got for this one. 67% don't know how their SHAC will meet next year, 14% hybrid, I think that's 16% in person, and 2% online. So a lot of in person, a lot of hybrid. And again, I think we have that group that wants to learn more about SHACs. And last poll question before we go on to the next presentation. In the last 2 years, my SHAC presented to the school board. In writing, in person or online, not at all, or I don't know. All right, and let's take a quick look at those. Most don't know, 17% in person or online, 5% in writing, and 6% not at all. So again, it seems like we have a group that's ready to learn more about SHACs and the different processes behind SHACs and what they do. So With that, I'll pass it off to you, Michelle, and you can help teach everyone about shacks.
Oh boy, thanks guys. Good morning. I'm excited to be able to share information about advocating for school health through school health advisory councils, or SHACs. I'm Michelle Smith. I'm the state coordinator for Action for Healthy Kids, and I've been advocating for school health for like 25 plus years. So it's been a long journey. We've come up, we've gone down. So I think we're hopefully going to be in a moving forward position. Just a little bit about Action for Healthy Kids, along with our vision and mission statements on this slide. We think it's important to highlight the roots of our organization. It began back in 2002 when Dr. David Satcher declared we had an obesity epidemic. Texas had actually been working on nutrition and physical activity and passing policies through the legislature. We're trying, and we're getting a lot of traction. But once this happened and we formed a Texas team, we started seeing a lot more progress and a lot more willingness, to listen by state legislators about the issues around school health and children's health. Next slide. Hello. You can visit the Action for Healthy Kids website. There's a lot of resources there around COVID-19, webinars and trainings and tip sheets. And then we also do provide some grants across the state around nutrition, physical activity. So today we want to talk about school health advisory councils and how they can support the important work around child health. We're coming out of the other side of the pandemic and all the issues that relate to that, but we have to make sure that we're addressing all of the health issues that impact our children and doing everything we can do to keep them healthy and ready to learn. Moving past just keeping them safe from COVID and focusing on some of the other issues and consequences from the pandemic that are impacting their health. Oops. That's what happened there? Am I missing a slide? Okay. So a lot of the risks, a lot of the things that impact our children's health are behavior related. As we've progressed and found solutions to a lot of different illnesses and things that plagued our children, and when I was growing up, it's become more of a choice, risky behaviors. So finding ways to address these things, especially with children spending so much of their time in school, is important. And trying to make sure that they're getting the right information is a part of what we can do through schools. Schools advisory councils can help develop policies that can help support teachers and the district in providing what's needed to keep kids healthy and ready to learn. Next slide. Because of COVID, well, I think we have the wrong PowerPoint here because I'm not getting the slides that match up with what we're talking about. So school advisory councils are vital to helping parents in the community have a voice in decisions. Everything from school meals to staff wellness is an important part of what SHACs do. Next slide. School health advisor, excuse me. When the pandemic started about 2 years ago, we had been working with SHACs for years, providing webinars and different information, but we pulled together a work group that is part of our steering committee as well as for school districts to talk about how we could better support the school health advisory councils and how they could play a stronger role during the pandemic in supporting school districts and making sure that the community as well as parents could be at the table as decisions were made around how to react to the pandemic. So our group met and talked, and we came up with some resources that we felt would support SHACs and how they could move forward. We did some webinars, one of them on how to reopen after they've been remote learning for the first half of the pandemic. And so we were really excited that we were able to provide some support and information for the districts around school health advisory councils. This work group is still working. Next slide. And this past year, we felt like we really needed to be able to reach out to the SHACs across the state. So we decided we needed to form a school health network. So we've been working for the last year to develop the Texas SHAC network and get as many people as possible across the state to join. And this strictly focuses on things related to SHACs. We work on webinars, we work on providing information around the whole child. And so our next step after this was to develop a website. Next slide. Just a little bit about who's currently in the SHAC network. We have 264 members. We definitely would like to have more. We are thrilled that we are getting a lot of members from different districts across the state. We have 130 distinct school districts represented in that membership. Our demographic characteristics are fairly diverse. They're not representative of the state, but we're hoping as our network grows that we will become more representative. And we have focused on trying to gain more rural, and we do have like 58% of our districts with 10 schools or less. So we feel like we are gaining because it's really important, as you saw from those the slides from the wellness policies, to have the rural districts be part of this so that they can have a better resource for wellness policies and all the work that SHAC should be involved with. Next slide. Part of what we did over the past year as well was develop some information, because as we were looking at the statistics of the people that aren't members of SHACs that are on this call, a lot of people don't know what they are, don't understand what they're supposed to do. There's a lot of confusion. We've been really challenged at the legislature when we've gone to talk about policies, because the legislature, when SHACs were formed, they were formed to look at sex ed curriculum and make sure that the values of the communities and the parents were included in health education in Texas. But they are so much more now than that. SHACs have evolved, and now they're mandated to have a physical education committee and try to help districts and campuses provide more physical activity. But parents and even in school districts don't know exactly what SHACs do. So we developed some resources. The first one was to explain to parents why SHACs were important and why it was important that they belong to a SHAC. Then we did one on for existing members to explain if you joined a SHAC and you're not sure what you should be doing, here are some of the things. If your SHAC's not focusing on these, then you can help guide your SHAC. And then we did one for legislators, because we really hope that our members, as we move forward, will help us educate legislators on what SHACs are responsible for and how they can be supportive of school health and supportive of student success. Next slide. The other place, the thing that you can find those resources and a lot more at the Texas SHAC Network. So we have developed a website. Just the group that works on this as volunteers. There is no formal SHAC network or a person in charge of SHACs right now. It is all volunteers from our partners and Action for Healthy Kids to try to support this group. In the past, there has been support, and there is support to a certain degree from the Department of Health, as well as the Texas Education Agency, and you'll find those resources on the Texas SHAC Network, as well as a lot of other opportunities to find information that can help you with your School Health Advisory Council and also with your wellness policies. So it's a great thing to visit. And I think the next slide shares, this is just a screenshot of the website. We have information on School Health Index, which is a CDC evaluation tool that helps you identify how your campus is doing as far as implementing wellness policies and evidence-based approaches to child health. Under the wellness policy category, we have resources to help you evaluate actual policies. The Rudd Center has developed over the years an assessment tool that can be used by districts to, as well as the templates that are done by TASB that can help in development of wellness policies. SHACs, over the years, we've passed a lot of laws that govern SHACs. Parents should be a majority of the members of SHACs. The parents should be a chair or co-chair. They're responsible for reviewing and making recommendations on recess policies. So all of those laws can be found on this website, as well as information. TEA does school health surveys, and that information, links to that is there, as well as links to a whole child model, CDC information, and the National Association of School Boards, who have policies that they track from all across the US, and, so that you can look at what policies should actually look like. So I really hope that you can visit the website and spend a little time there, and you'll find a lot of ways to support, or if you have a SHAC that's not functioning very well, it'll give you ideas on how you can move forward and help your SHAC. Next slide. I think we keep skipping slides, but that's okay. One other thing that's helpful is we have done videos for many years around school health and around school health advisory councils. So if you go to YouTube, you can just search Healthy Kids, Healthy Families, and there's over 100 videos there on everything from parent engagement, social emotional health, outdoor education, wellness policies, SHAC 101. There's a couple of SHAC 101s if you just want some basics, because I've really just hit very few highlights here today. So there's a lot more to learn. And I am always available for a phone call or a consult on anything SHAC, as well as I have partners. AgriLife Extension, our volunteer chair for the Texas Action for Healthy Kids Steering Committee is AgriLife Alice Kirk, and she and I spend a lot of time talking to different school districts and different SHAC leaderships and trying to help wherever we can. So we're more than welcome to share information or help you find answers to any questions you might have around wellness policies or around school health or around SHACs.
All right, thank you, Michelle. I don't know what happened with the slides there, but we'll make sure your full slide deck gets sent to the organizers so they can post it online and make sure that all the slides are included there. I think we're gonna take time for some questions here in a second. So if you wanna put those in the chat, we'll start looking them up. I also wanna make sure that everyone got the link in the chat to the Texas SHAC network, as well as the Survey Monkey link that we put in there. One is to help you join the Texas SHAC network. The other is to check out the website that Michelle did a great presentation on. I'm sure as she gets more resources, that'll continue to be updated and continue to grow. So if those links are not in the chat, they'll be in the presentation, but make sure you check out those two things. I think we have one last poll question before we jump into our Q&A here. If all the presenters want to turn back on their cameras, we'll hop into that poll question and then go straight into the Q&A. All right, question. Have you joined the Texas SHAC network? Yes, no, or I will now. All right. Yes, no, I will now. There we go. We got some people who are going to join, some people who already have joined, and some who have not joined yet but are still thinking about it. All right. And then if everyone wants to pull up their videos, I think we're going to jump right into the Q&A here. Let me get our first question. Let me see. Question 1. My school has a wellness policy. However, the items chosen are often things the kids aren't likely to eat. For example, the vegetable in our school lunches is often a piece of lettuce with a tomato on top. How can we encourage the school to serve vegetables the kids are more likely to eat? I will open that up to everyone. Any thoughts there?
That's a good question. And a lot of times that's where a shack can help. You can have, if you have a school advisory council that's active, you can have the child nutrition director or food service manager attend a shack meeting and have your parents there to talk about what are the issues and what are the challenges. Sometimes it's a case of right now there's issues with supplies, and they may need to look at new sources for finding different fruits and vegetables that they can use on a regular basis. Things that school meals are serving now are not what they were serving before the pandemic. But again, like I said, I feel like this is a case of find out why that's all they're serving, and if there's something that can be done, maybe there's a way the community can be supportive.
Great. Laura, Swati, anything related to wellness policies? Any thoughts on how that could be leveraged to improve the vegetables in school meals?
One of the school, well, not necessarily thinking about like improving what lunch is served, because I know that is probably a difficult conversation and one that's with the nutrition director. Thinking about farm to school, which is a policy goal, looking at creating more support for those. So maybe there's local produce that can be brought into the system as a supplement for larger supply chains. That could potentially be an option.
Great, thank you. Next question. When evaluating the rural school evaluations, was the fact that students in these areas may have more physical activity outside of school due to farm duties and less technology? Any thoughts on that, Swati?
From what I remember, I think we did correct for those things, but we were just mainly looking at what was established in the timeline of them in school. So it is possible that due to their like outside activities, they could be, but I think we were just mainly focused on what was happening within the hours of school activity.
Yeah, I'll also add to that and say that the wellness policy can have goals really about anything, and maybe they didn't choose a goal related to increasing amount of physical activity minutes because they believe their kids got more time outside due to farm work or other things like that. But the goals really can be anything in these wellness policies, right? So they could focus not necessarily on the number of minutes, but the quality of the resources available, the types of certifications that teachers have, the opportunities throughout the day for it. So, well, yes, they may not have chose one specific goal on the template because they believe their kids are getting a larger amount elsewhere. I think there are other opportunities within the wellness policy to think about goals that might be applicable to districts. And so we can do some tailoring in that space too. Next question, does this include oral health? Michelle, do you want to talk a little bit about if any shack related things focused on oral health, and then we can talk a little bit about wellness policies and how you could potentially include oral health in those?
I think, oral health is something that's overlooked in a lot of cases. And one of the ways that you can help through your shack is to make sure you include someone from the oral health community on your shack, because that's one of the serious issues that a lot of children face. I know our shack, when I was on one, we worked with the community, and they had a mobile unit that went out and helped with the kids, providing free exams at the schools. So if you can make sure that the shacks consider and also include oral health as part of what they're reviewing, and definitely putting something in your policy.
Laura, any thoughts on where this might fit in the policies?
It would be an other school-based health activity. Off the top of my head, I don't remember seeing an oral health, but I have seen mental health fit into that category. So I assume oral health would fit as well.
All right, next question. I know much of the discussion today was on nutrition and physical activity related policies within a school. As a public health practitioner, how would I go about with creating and implementing policies within school districts that focus on other health topics, such as improving air quality in students with asthma? Any recommendations or advice?
So from a school advisory council perspective, I always say that the shack should focus on the things that are most relevant to their community and their schools. And so that's one perspective on it. I think that your shack has to be diverse. And one of the things that we recommend is that you use the whole child model. We didn't talk about that, but you will find information on that Shack Network website. That encompasses all of the different perspectives of the child, from health education to nutrition. The reason that we focus so much on nutrition and physical activity is because that's what's mandated in your wellness policies. And so that's where we've always put the most emphasis. But we would prefer that shacks and all districts look at the whole child and look at staff wellness and look at community engagement and look at health education and things that aren't necessarily required as part of your wellness policies.
Yeah, I think that's a good point. I think in a lot of our conversations and reading through a lot of these policies, many school districts are using the local wellness policy because it's something that they have to do and is required by the state. And yes, the TASB template helps you do that in a way that meets federal guidelines or state guidelines. But if you already have to do it anyways, I think there's a big benefit in thinking about health more holistically. And I think there's a level of accountability when you start putting these things in your policy, right? And so I think it's very important that we start to think about beyond physical activity and nutrition. Yes, we still want to meet the federal guidelines, but I think we want to start putting more things in local wellness policies that target other areas of health. And maybe asthma is one, and maybe mental health is one. It can really be up to the district. And so I think focusing on what are your priorities as a district, listing them in that policy, and then creating an action plan that helps you carry them out is really important. Michelle talked about putting them in the policy, and I think one of the resources on the Texas Shack page is actually the whole child model, but there's also a tool that was just put out by the Rudd Center to evaluate if your policy is meeting that whole child model. And so that might be a place to start, is to look at that whole policy or whole child policy evaluation tool. I think it's on our Texas Shack website. I think it's also on the Rudd Center website, and start to see, is my policy addressing things more comprehensively, and should I be thinking about other things in different spaces? So any other thoughts on that question? Next question, and I think this is for you, Michelle. Are any of the Shack videos available in other languages?
Sadly, they are not. I am so sorry. At this point, we have not been able to translate. So again, like I said, part of this is we're all volunteers, and this is all, no budget type thing. So we're able to just do the minimum on some of these things.
All right. Yeah, and I think it's something we can definitely work towards as a working group, right? Getting some of those translated and up there. I think this was on one of your slides that somehow got cut, which I'm gonna have to look into it. One of the next steps for the work group is that we have an intern who is working with us this semester, and maybe that is one of those priority things that we can have them work on, is translating some of those videos. is there a recommended number of goals? We are a rural community and we would like to know if we need to improve. Laura, Swati, any thoughts on a recommended number of goals or evaluating, do they need more goals or not?
As far as I remember, I don't think there's a recommended number, but I think this is, I think it's just important to consider your school district and what is important to your school district, as the other panelists have mentioned. And there's a lot of value in understanding what's required for your school district and using those metrics to kind of leverage your wellness plan to create it more uniquely towards your school.
Yeah, and just to add on to that, you know, policy kind of sets some guidelines that you work towards. So the more that you kind of have, the more things that you're ideally working towards. So there's probably not a perfect number, but at least if it's on paper, it's something that's there to aim for in practice.
Yeah, I'll say in these analyses, we used number of goals as kind of a proxy of how good the district is doing, right? But more goals doesn't necessarily mean better. If you have one goal that's implemented really well versus 20 goals that aren't being implemented at all, I would really love to see a district do one goal really well as opposed to none of the 20 goals that we have listed, right? So we don't have any data right now on how many of these goals they're actually carrying out and implementing once they've done them. We're kind of just using total number of goals as a proxy for it right now, but that does have some limitations. And so I think it's important to point that out, and I'm glad whoever added that question brought it up. I think we have one more question here. I think I joined the Shack network before. Is there any way to check? And I think that's for you, Michelle.
Yeah, just send me an email and I can double check and make sure. We are not sending emails unless it's, you know, something coming up that relates to Shacks. We did send one recently with a couple of webinars that are coming up this fall, and we sent out this webinar as well. But just shoot me an email. My email should be part of the information you get in follow-up, and I will check.
All right, thank you everyone for your informative presentations today. We'll go ahead and, oh, sorry, I'm reading the wrong part of this. It looks like we've covered all our questions. Thank you everyone for attending today's webinar. We appreciate you being here. Remember, the webinar will be archived on the Michael and Susan Dell Center website at msdcenter.org. Thanks again for joining us today. We'll see you next time.
Thanks.